How does Medicare Part D work if you buy it as a standalone plan? And how does it work if you enroll in the Medicare Advantage plan with a built in Part D drug card? Fortunately, the stages of Medicare Part D are the same in either case, so let's walk through the basic structure of Part D plans. Although Medicare Part D plans are offered by private insurance carriers, each plan must meet minimum federal guidelines. All drug plans have 3 stages in 2025 and beyond, including those inside of a Medicare Advantage plan. Medicare sets the limits for these stages each year, and companies can offer benefits that are richer than the minimum standard, but not less than that standard. The 3 stages of Part D are the deductible, the initial coverage stage, and the catastrophic coverage stage. So let's start with the deductible. The deductible is the amount that you pay out of pocket first each year on your medications before your copays kick in under your Part D plan. Medicare sets the maximum deductible each year, and Part D insurance companies must keep their plan deductible at or below that number. In 2025, the maximum deductible allowed is $590. Again, companies can waive that deductible or set a lower deductible for their plan, but they can't charge a higher deductible. Most tend to stick with whatever highest deductible allowed by Medicare is each year, but how they apply that deductible can vary, as you'll see here in a moment. So here's how a deductible works. If your plan has a $590 deductible, you will pay out of your own pocket for your medications until you have spent that much and satisfied that deductible. For example, if you have a medication that costs $100 when you go to the pharmacy, you will pay $100, and then you will only have $490 left to spend before you fulfill the deductible and move on to stage 2, the initial coverage level. I mentioned earlier that some insurance companies may offer a lower deductible than Medicare standard, or they may waive the deductible entirely. A plan with no deductible, though, isn't necessarily the one that is the most cost-effective for you. Sometimes you may find a plan that waives the deductible, but it may also have higher copays or premiums than another plan that does have a deductible. In my experience, you'll spend that money one way or the other, either in an upfront deductible or tacked onto the copays that you spend throughout the year. Here's a tip: if you take mostly inexpensive generic medications, look for a Part D drug plan that applies that deductible only to the higher drug tiers. On these plans, you can often get your Tier 1 or Tier 1 and 2 medications from day one for just your regular copay, no deductible applied. This way, you only incur the deductible if you have drugs that fall into the higher tiers, which are usually for brand name or specialty drugs or for some of the most expensive generics. Each plan gets to determine which tier it will place its covered drugs into, and during stage 2 of your Part D drug plan, you'll pay copays or coinsurance for those medications based on which tier they have been assigned to. During the second stage, also called the initial coverage level, you will pay that copay or coinsurance for each medication, again, based on which tier the drug falls into. Insurance companies create a formulary for each plan, which is a list of the drugs the plan covers. These drugs are usually broken into 5 tiers: preferred generic, non-preferred generic, preferred brand, non-preferred brand, and specialty medications. Each tier will have a copay or coinsurance associated with it, and sometimes you'll see a 6th tier, which on some plans is for insulins that the plan covers, which by law must be set at just a $35 copay from you. Typically, the first tier will mainly include preferred generic drugs that have the lowest copays, and the 5th tier will include mainly specialty drugs which have the highest copays or coinsurance. This is why you pay a percentage of the drug instead of just a flat copay. For example, you might find that a drug plan has a $5 copay for preferred generics, a $10 copay for non-preferred generics, and a $40 copay for preferred brand name drugs, and so on. The copay or coinsurance amount listed for that tier is what you will pay for your medications in that tier when you pick them up at the pharmacy. Now, as you're filling these medications, Medicare is tallying your total drug spending. If the total drug spending goes over a certain limit each year, you fall into stage 3, which is catastrophic coverage. This is the stage that kicks in to protect you from catastrophic medical spending on your medications. Once you reach stage 3, your Part D carrier must pay 100% of the cost of all of your medications for the remainder of the year. In my opinion, having catastrophic coverage is the single best reason to sign up for Part D. It greatly limits the spending that you would otherwise pay for catastrophically expensive medications. In 2025, the limit is $2,000 for the year, which is significantly lower than last year's out-of-pocket limit, which was $8,000. Some people get their drug coverage through their Medicare Advantage plan, which saves them from having to pay a separate monthly premium for a standalone Part D drug plan. Medicare Advantage plans have a maximum out-of-pocket limit to cap your spending after a certain point in a calendar year. Just be aware that the maximum out-of-pocket limit on your Medicare Advantage plan only includes Part A and B expenses, which are your inpatient and outpatient care. Your Part D costs are separate and additional with the same 3 stages and $2,000 limit that I described in this video. You may have noticed that I didn't mention the coverage gap or donut hole, and that is because it is now a thing of the past. Beginning in 2025, plans no longer have a coverage gap. So you don't have to worry about the cost of your medications going up when you reach the coverage gap. Do you have general questions about Medicare Part D drug plans in 2025 and beyond? Drop them in the comments below, and we'll do our best to get you an answer. Lastly, did you know that Medicare has a new prescription drug payment plan that allows you to spread the cost of your medications out over the course of the year? To learn more about it, check out this video next.